And then the other one's sitting.
Dorsal is upside down.
Oh, okay.
Is on your back. So your dorsum is on the back. So so I don't know if they're gonna ask you, I mean, it's in my mind when they say prepare an animal for an OVH, that means you put them in dorsal recumbency, shave them, but all they want you to do is to do the scrubbing part.
Yeah, at the competition they had it tied to the table already.
Already? Okay.
Yeah.
And
All right.
it's like shaved and stuff.
Okay.
I don't know.
Can we pretend this is a, where the incision's gonna be and do the table?
Yeah.
All right.
Yeah.
Okay.
Cool. Yeah.
So I'll just do it real quick and then, and I'll make some little comments. Okay, so one thing that they make a really big deal about is that you need to do the scrub and the solution 3 separate times. That's a big deal. What I would say is that those 3 separate times are after the pet is clean. After you do not see any visible dirt. So what we do in the real world is that we shave and then we clean them with scrub, which is soap, and you can feel the difference between the soap and the solution. We clean with the scrub until we see no dirt, and then we go on to do our actual surgical prep, which is using aseptic technique. Okay, so I don't know what they are gonna want you to do. I know I saw at the very end they say something like at least 3 times till you don't see dirt. In the real world, you shouldn't see dirt when you actually start your 3 surgical scrubs and solution. Okay, so what I would do, bless you, what I would do is I would take your scrub and scrub. You're still gonna want to start from the center of where your surgeon's gonna incise, then go to the outside, all the way. You never wanna take everything from here and move back in here. Okay, so you're gonna, let's say it's clean, we've cleaned it. We're not seeing, actually this tables are pretty clean. So we're not seeing anything. So then what you would do is you would take your scrub is always first because it's soap and you never wanna leave soap on the body, right? You would take one gauze and you would start in the middle and then you go around, all the way out as far as your surgical site's gonna be, and then you toss it, and then you take your solution, do the same thing. And you're wiping off that soap that you just put on. You toss it, and then you do it a total of 3 times. One thing I'm not doing that I should be doing is every time you do this, you look. Make sure it's not dirty.
So it's scrub, soap, scrub.
It is scrub, solution, scrub, solution.
Okay.
The way to remember scrub, at least in my mind, is that when you take a shower, you're scrubbing with soap. You're not just gonna leave soap on your body.
I love the solution of the scrub.
You end with the solution because you don't wanna leave soap or scrub on the body. Alright? And look, you make sure that it's not dirty, and then you're done. The other thing that I would say, 2 other things in the real world, is when you are preparing an animal for surgery, you should have a cap and a mask on. Because if you're over the body scrubbing, you're exfoliating cells that are not sterile onto your sterile site. So you really should be wearing a mask and a hat. And the other thing is, if you're using chlorhexidine solution, which is the most common in the real world, your final should be alcohol spray. So that's not on there, but in the real world, that should be your final.
Without wiping it off.
Without wiping, because
Okay.
it's gonna evaporate.
Yeah.
On its own. And that's it. So do we hit every single spot?
So you do it 3 times. So you do scrub, solution, scrub, solution, scrub, solution.
Yes.
Okay.
After it's clean.
After it's clean.
Yep.
So you would, the first time you do it, you would clean it with the solution or with the scrub?
So
Scrub.
the scrub. So the difference between the scrub and the solution, I know they look exactly the same, but you're gonna feel it. The scrub is soap, and so that's what you're cleaning with. The solution is think of it as like a rinsing solution. It's the same disinfectant, but this is soap. Soap is actually, that's what's gonna get the dirt off. This is just, all this does is a sterile solution to take off the soap. Because if you left soap on your body, you'd probably get pretty itchy and irritated.